this is task number 35, administering an enema. We are just going to be modeling an enema today. This dog doesn't actually need one, but we do have a solution here of KY jelly, warm water, and a little bit of a gentle detergent, just some Dawn dish soap. So I've got that all mixed together. She weighs 3.2 kilograms, so she can get anywhere from 16 to 32 milliliters of our enema solution. I'm going to be using a 60 ml syringe and an 8 French red rubber catheter here. We could do, if this were a larger patient, we could use a larger tube and probably an enema bag, but because she needs such a small volume, we're going to just stick with the syringe here. So I'll remove my red rubber catheter from its packaging. Go ahead and draw up, we'll draw up 30 milliliters of solution. Maybe we'll do 35 since we are going to lose some in this tube. I bet that can hold at least a milliliter. Get the air out of there. This can usually be done without sedation or anesthesia. Sometimes if you have an obstipated patient, if they're really painful, we would want to do this under at least sedation, if not general anesthesia. So I'll clear my tube there, make sure, there we go. So what I would do is go ahead and apply some lubricant to the end of this tube. We're going to be inserting it 2 to 3 centimeters for a patient this size. In a larger dog, you'd want to go 5 or 6. So I'm not actually going to introduce this, but my assistant here would just hold the dog kind of like we're taking her temperature, and then I could insert this 2 to 3 centimeters and then try to pinch around the base of it so that as I'm injecting the solution, it's not going to leak back out. I would slowly withdraw this, and we're doing this on a wet table because this often gets really messy really quickly. So if we did start to see her expel the contents of the enema, we have a table that she can do that, and we would then place her outdoors in a dog run so that the enema can take effect. And if we were doing this for something like fluoroscopy or radiology of the abdomen, and I really wanted to get everything cleaned out of there, I could repeat this process several times until we don't have any feces left in the colon. And that concludes task number 35.